Good afternoon, everyone, and thank you for joining us for this week's National Bleeding Disorders Foundation, formerly National Haemophilia Foundation, Wednesday webinar. My name is Fiona Robinson, and I'm the series host. This webinar is being recorded and will be available to the community on the NBDF website, bleeding.org, shortly after the webinar. In today's webinar, we will learn about breaking barriers, advancing inclusivity in inherited bleeding disorders, spotlighting the EHC ERIN initiative. We encourage you to ask any questions you may have today. You can ask your question by using the Q&A feature at the bottom of your screen at any time during the webinar. We will monitor these questions as they come in, and following our speakers' presentations, we'll put your questions to them. Today, we are very pleased to be joined by two of our good friends from the leadership of the European Haemophilia Consortium, Miguel Cratu, who is the EHC president, and Olivia Romero-Lux, who is the EHC CEO. I'd like to thank Miguel and Olivia for joining us today, and I will turn things over now to Olivia to get us started.
Thanks, Fiona, and thank you for having us to cover such an important topic that is very dear to us. I'm the CEO of the EHC, and I'm going to start by explaining to you how we want to cover this topic with Miguel. So I'll start with a general overview of the EHC and present the background that led to the leadership wanting to tackle the topic of inclusivity. And then I'll hand the floor to Miguel, and he will cover in more depth what the EHC has done so far and what we plan to do in the future. So next slide, please. So for those who are not familiar with Europe, you have two institutions in Europe. You have first the European Union, which is composed of 27 members, and then you have the Council of Europe, and we represent a lot of countries that go beyond the European Union. So we are a patient-led organization, European-based. We were founded over 30 years ago. We cover and advocate for hemophilia, von Willebrand disease, and other rare bleeding disorders. We have 48 national members in 47 countries, which are the 27 EU member states plus Council of Europe countries. So we go from, to give you an idea, and that's why I put a map, because not everyone is very good in geography, and so to give you an idea of what we cover, where we cover is from Iceland to the top left of your map to the Russian Federation that goes to Vladivostok. And actually, I couldn't find a map to cover those countries we still represent, like Tajikistan, or we would like to represent like Kazakhstan. So apologies for those coming from those countries. If they don't see the country there, we still think of you. So it's 48 national members because we have two national members in one country because Kosovo is not considered a country so far. So, but they're still very welcome in our community. And that's why we have a discrepancy between the number of countries and the number of NMOs. But we have one NMO per country as per the WFH statutes too. We are based in Brussels. And why Brussels? Of course, because it's the heart of the European Union. I'm French, so my French friends wouldn't be happy because we also have offices in Strasbourg for the European Union, but the Parliament and the Commission are based mostly in Brussels. Next slides, please. So about the EHC, it was founded mainly to advocate at European level to shape policy, and that was very important. But then it became something more. The more NMOs, members, national member organizations we had, the more we thought we needed to support them, empower them, and make sure that at national level, they could also be effective and advocate for the rights of patients and family members. We also promote access to optimal treatment and comprehensive care for people with rare bleeding disorders, any rare bleeding disorder, not only hemophilia, not only von Willebrand, but any one of them. We engage constructively with all key stakeholders. So we work with the World Federation of Hemophilia. We work with the European Association of Hematologists and Allied Disorders. We also work with European institutions that help advocate for rare bleeding disorders, but also with rare diseases like ERIN, or European Patient Forum. We have lots of interactions also with the third parties like pharma industry to make sure that we can advocate and help patients get the best treatment they can, and also access markets for those industries so they can provide treatment for patients. As you saw just before, we represent a lot of countries, and of course, there are lots of disparities between countries. So it's very important to make sure that we represent everyone in the community. And last but not least, as I said before, our main objective was also to help and influence shaping the European policy. Next slides, please. So we've done that for a while. We've secured quite a lot of achievements, and at some point we decided to have a new strategic plan as usual. And in 2024, we started a strategic plan to refocus on what was needed within the community. Next slide, please. So we ended up with having 3 pillars and 3 main objectives: advocacy, communication, education, and medical. But what is really important for us tonight is the advocacy part, and that's one of the things that we want to move forward with, is inclusivity and information dissemination. So we want to ensure that inclusivity and information is disseminated and by providing comprehensive resources covering all bleeding disorders, including all ages, genders, and social backgrounds. So we pretty much help also promote platelet dysfunctions, super rare, extremely rare, very rare bleeding disorders, but also we support the Women Bleeding Disorder Committee, so the Von Willebrand Committee. We make sure that everyone is heard and can speak freely in our community. We also promote awareness and understanding of extremely rare disorders to ensure no one is left behind. So it's awareness with healthcare providers also. So we work with EHAT, the European Association of Hematologists, to make sure that physicians in every country know about those bleeding disorders. We help them define the resources. We also plan visits together to make sure that we work jointly and we join our forces and represent the whole community when needed. We also collect relevant data and conduct targeted surveys to support advocacy initiatives and ensure the proactive inclusion of voices of patients in Europe. For a very long time, we only spoke on behalf of the hemophilia community, and it's time for us also to represent new populations. And that's been already, as I said, now those populations are also making themselves visible and they speak out. So we need to listen to them and help them in that initiative. So next slide, please. So what did we do then when we realized that we were maybe not inclusive enough? So in 2015, back in 2015, the EHC launched a program to cater for people with hemophilia that have inhibitors. And that was already a population that was invisible among the community. So as those populations are super small, we decided to work on European level because it would be easier for them to gather and to be together instead of having just 2 or 3 or 4 per country in some countries. So it was a great success, and so successful that in 2021, we had to define new goals. It was really amazing how a community that was completely invisible within a larger community of the bleeding disorders became visible and was heard. And you could see in every event we organized that people with inhibitors could travel, whereas before they would stay home and had never been out of the country. So it made a huge difference for that community. And we thought that if it worked for the inhibitors community, it would work with other bleeding disorders. So in 2022, it was decided to expand the network to include people living with extremely rare bleeding disorders. And having witnessed the success of inhibitor community, the HC decided to capitalize on this experience and success and create a space that was not a new space, but a larger space. So we had the inhibitor network, and we decided to create the ERIN committee. And the ERIN committee was the European Rare and Inhibitor Network. Because of course, we're not letting the people with inhibitors behind because they've been covered, check, and that's it. No, no, no. They are still in the process, but we open our doors to new patients and family members that needed support. So next slide. So the objectives of the ERIN committee are super simple. We need to understand and prioritize the needs of those people because they've been quite silent. They've been almost hidden within the community, like the needle in the haystack. So we need to understand what they needed, and then we needed to empower those people to foster research in the field and to also advocate at national level. But for that, you need to enable social and intellectual connections between those people and also between those people and the caregivers to support each other, and also to maybe establish and create resources, education resources, and moments where they can learn together and share experiences. So we also wanted to ensure that they would be active and effective in engaging with decision makers to ensure that they receive the treatment and the care that they need. In order to ask for treatment, you need to know what the treatment is there, and that is the best convenient for you, the most convenient for you. So we need to educate those people to speak for themselves, and to be assertive. And also, as I said before, we did that. The objective were those, but we still wanted to offer the necessary support to people with inhibitors and their caregivers, and ensure the transfer of knowledge to local inhibitor communities. So we did at European level and wanted to make sure that at national level, they would have the same support, because of course we work in English and not everyone in Europe speaks English. So we need to be more in a granular approach at some point. So we start at European level and then we go national. So with this said, I'm going to hand the floor to Miguel, so he explains to you in detail what was done afterwards.
Thanks a lot, Olivia, for a comprehensive explanation about THC and the objectives of the European Rare and Inhibitor Network. In fact, the first thing that I must mention is the question of nomenclature. Are we talking about very ultra extremely rare bleeding disorders? But in terms of these people, this condition, what we need to say, and it's important to say, and in terms of inclusivity, is this is a group of people, of underserved patients in our community, especially in the most in some areas that are not very well served in terms of treatment of care. So we decided to go beyond, as Olivia said, go beyond plain hemophilia without inhibitors and von Willebrand disease, and then we start creating our ERIN group coming from the European Inhibitor Network. Slide, please. So we are extremely rare, but many and orphan in some cases. So we have here what are the conditions that are under our program. And as you can see, the incidence from these conditions vary a lot, from the incidence of 1 per million for 1 per 500,000, and even for when we talk about factor 5 deficiency, we are talking about 125 people all around the world. So as you can see, they are very, very rare, in some cases super extremely rare, and we recognize that this kind of people lived usually in terms of community very isolated, very underserved, and we need to create a program for them. Slide, please. So we are embarked in the new journey. As Olivia said, all started with the European Inhibitor Network, and we created on EHC the European committee, and then we understand that this type of conditions have different needs, and they need to be tackled in a different way than simple people with hemophilia without inhibitors, or even people with von Willebrand. So it's not, we didn't discover, of course, it's not rocket science, but we decided to divide it in 3 tracks. Our objectives. So the first one is related with education. It's related with education, and it's related with giving the basic knowledge to these people with extremely rare bleeding disorders to go towards autonomy and can be able to by themselves fight for their condition and for their quality of life. So this is a process that will not be easy. Of course, we need to go first for our NMOs, for our national member organizations, to engage with another stakeholders. But the key point is to provide information and to provide education towards autonomy. The second point is to ensure that we can pass the knowledge that we already have with the inhibitor network, especially because in a lot of countries under EHC, there were created some inhibitors committee. So we already have the experience of working with this underserved population in our community, and their basic needs or these basic unmet needs are quite similar to these extremely rare bleeding disorders. So we need to take these learnings in consideration and apply it to the extremely rare condition. So in an ideal world, we should morph all the inhibitor committees that we have all around our countries to extremely rare bleeding disorders committees. But we are going to try that. It's not going to be easy, but of course, it's one of our main objectives. And track 3, it's with advocacy and better treatment and care for all. Because when we talk about some conditions, and even if we think about hemophilia A with inhibitors, that right now everybody recognizes that it's in a better position due to the treatments. If we think that in several countries around Europe, not to talk about all world, but especially in the Eastern Europe, there are people that haven't access to this kind of treatment that all Western countries have. They are underserved. So this is a mark for us. This is a point of honor for us. And of course, this is the objective of work for us. So we are starting from scratch, it's true, but all we need to do, it's very basic. It's assess the needs and seek to build a program for our community that to serve their needs and to serve what they really need to ensure a better quality of life for these patients. Next slide, please. So what we did was try to start a first survey to map the needs of these people living with extremely rare bleeding disorders. Slide, please. Next slide, please. Thanks. So we create a survey, a very basic one for the first, before we create the ERIN committee. So we need to inform about the establishment of the European Rare Inhibitor Network. We target all our 48 NMOs. We target some hemophilia treatment centers, and we did a survey in English and Russian, so we can go to the most eastern part of Europe. Slide, please. The profile of our respondents, so we had 34 valid responses, 8 from our animals. We could have in our answers people with Glasman thrombocythemia, fibrinogenemia, factor 2, factor 7, factor 11. So as you see, not all of them, but at least we think a good representation of the most important extremely rare bleeding disorders. And even we have 2 answers from 2 people that are undiagnosed. They know that they have some form of extreme bleeding disorder, but they are not diagnosed yet. In terms of gender equality, we have male and 13 male and 19 female and 2 other. And from age, we range from 4 to 75 years old. Of course, we have some parents that answer back to our survey. Slide, please. So 60% in terms of results, what we get is next slides are going to show. So 60% of the people that answer to our survey do not participate in the activities of the NMOs of or other patient organization, and the reason they present for that is generally, and we all know that I think this is not a secret for everybody, in the not in the last years, but in the, let's say 10, 20 years ago, it was normal, special at an NMO level, that the meetings, that the conference, the events that all the NMOs organize were basically based in hemophilia, on their needs, in their kind of treatment, if they have access to treatment or not. So these people feel that they were not represented, and of course they were not keen to go there and listen to talk about other things that will not solve their problem. So this is what was a major result from our survey that we already hint from our previous conversations and from the previous contacts with our community, but it was important to have it on right and to have a survey that based on this impression. Slide, please. So current changes, and these two slides are basically what they, in a large array, said to us. So lack of information regarding my bleeding disorder, not only at the NMO level, but especially and most important in the HTCs. They don't know a lot about the extremely rare bleeding disorders. It's not just a question of going to the hospital, having their treatment if it was the case, and it was, like, for example, factor VII deficiency or inhibitors, but they don't have a lot of explanation about what means even in clinical terms and scientific terms to have that disorder. So this impairs them to have a better understanding of the treatment and to a better management of it. A sense of isolation. This was very common already in the inhibitors environment, in inhibitors community. Generally, these are people, due to the lack of treatment, they don't risk too much in doing some risk activities. But even if we are thinking in the terms of normal life, of doing normal activities that other people with hemophilia do, especially they try to refrain themselves to do it. So they prefer to be isolated in their houses and don't cooperate with other people in their community. This leads to a huge level of psychological, emotional discomfort. These are people that generally tend to be not very in a very good situation in psychological terms. People that are always not with good social skills, people that are always in need of psychological support. And the problem is that in many centers, despite they are entitled comprehensive care centers, they don't have access to it. So the psychological and emotional discomfort was a very huge answer from this group. Limited access to treatment, including treatment options and or difficult medical management. Due to the scarce number of some of these diseases, it is very, very hard for them, and even for the doctors, because sometimes the doctors are not very well prepared or trained about these bleeding disorders, the extremely bleeding disorders. They were not very prone to fight for their treatment and or at least to have the basic science and the basic knowledge to deal with it. And as I mentioned, a great difficulty in participating in social and professional activities. Slide, please. More answers for our survey. As I said, there isn't, even in the world of hemophilia, sometimes, and in some centers, it's difficult to have proper information from hematologists. They don't have time, they don't have the space to do it, they have other business to treat, and it's very difficult for them. So you can imagine for extremely rare bleeding disorders, these challenges are higher, and they don't have any access at all from the hematologists because simply they don't have time. Probably some of them mentioned that the nurses could occupy this lack of space in terms of knowledge, in terms of information, but it was an answer that it was quite shown by our population. No information in the general population, including emergency rooms, general practitioners. And this is very important. This was already a topic for people with hemophilia in general, that there was a huge gap in treatment regarding to ERs and attendance in ERs. This is for a lot of these bleeding disorders, this could be a matter of life or death. So it will be nice for them, of course, it's essential that the emergency room have some kind of protocols and very good information to treat with this. And this is a major preoccupation for them, to be in such a position that they need to attend the emergency rooms and they are not taken care properly. General information about what and if something is going on in research of future treatment. Of course, for hemophilia, we have a lot of research right now. Especially in this moment, we are super busy with lots of new treatment, with lots of options. But because of the scarce numbers of this kind of extremely rare bleeding disorders, they are not appealing for the pharmaceutical industry to invest in them. So this is the thing that they complain a lot, and it's true. And we are trying to do something, and we hope that the ERIN program will at least give some input regarding this situation. Pain, bruises, mental impact. This is very important for these extremely rare bleeding disorders. We are talking about, in a lot of them, for example, some of the bruises that are not well seen as a major problem for people with hemophilia, because for hemophilia it's more related with articular and joint bleeding. For these people, the existence of constant bruises and constant pain could be very impaired for them, not only physically, but at a mental impact level. And the mental load of condition, of course, because it's not all, of course, but for the extremely rare bleeding disorders, but being with the disease constantly in their minds, in social terms, in psychological terms, in familiar terms, even in relationship terms, is very hard to manage. Not stopping at least to think for a moment about having this extremely rare bleeding disorder, and that something wrong can happen at any time. Slide, please. So what we decided to do is that in December 22, we have our first ERIN summit in Barrettstown in Ireland, and the people that were there through in 2022, the majority were people with inhibitors. Decide to create a manifesto. What was this manifesto? It was the founding stone of what will be the ERIN program and the ERIN objective. So we give the people that were there, special patients, parents, partners, the chance to present to EHC through a manifesto that they sign and that it affixed in our headquarters, the chance to tell us what do we want for EHC in terms of care, in terms of commitment, and in terms of giving us the tools necessary so we can build our own program and build our own way of trying to solve our problems. And the result was a document that is signed. And slide, please. Here is a document. So as you can see, we have all the signers of the people that were present at this summit, and they divided the manifesto in three parts. One for hemophilia A with inhibitors. As I said, there are still some unmet needs for these people, and we never know what could happen in the future. But special for certain regions, there are really lack of treatment. Hemophilia B with inhibitors. That is, in terms of inhibitors, a situation that we need to be constantly aware. And in terms of treatment, they are not there yet, despite we have, I think we have a good future in front of us, but the lack of prophylaxis for people with hemophilia with inhibitors, it's still a reality until now. And finally, the third part was for extremely rare bleeding disorders. So it groups all the other extremely rare bleeding disorders. So we the people that attend this summit recognize that these three areas are some kind of different needs each other, but they have at the same time common needs in terms of isolation, in terms of care, in terms of building a problem for them that can profit all of them. Slide, please. So the ERIN committee was created, and what is the role of the ERIN committee? Is develop and implement the content and the program, and especially the content of the manifesto, promote them through not only our community at large, but especially in the countries that are part of the HC, attract more participants, and was really worrisome for us, because in the beginning and in 2022 we have really few people with other extremely rare disorders, and not including inhibitors, of course, and identify people, scientific people, but not only, in ethical professionals, to contribute to the content of the program, and this is very important. So the composition of this committee is people affected by extreme rare disorders, people with inhibitors A and B, multidisciplinary care experts, hematologists, but not only. We have psychologists, social workers too, and is supported, of course, by HC staff and by the steering committee of our organization. Slide, please. So it is a group, a nice photo of the first ERIN committee. So we have here people with inhibitors A and B, people with Glanzmann, people with factor 7 deficiency, two healthcare professionals, and members of the steering committee and staff of EHC. Slide, please. So far, what did the ERIN committee? So we are part of two working groups from IAD that our doctor partners in Europe. So a working group about Glanzmann thrombocythemia, and a working group that is starting now about extreme rare bleeding disorders. We have been doing and organizing podcasts. We are doing a podcast called Bleeding Disorder of the Month. So far, this group organized the one for Glanzmann. So we still have another 12 to come, but I think for us, it's very exciting to start organizing, and sometimes the difficulty is to find people to participate in these podcasts. We are trying to influence other groups working in the UK. We organized the Rare Day webinar. As I said, we did the service to assess the needs of people with rare and inhibitors. We organize from bi-monthly, more or less, peer-to-peer support. It means that some members of this group facilitates meetings, online meetings with parents, another group with patients, and another group with partners. We have been speaking at conferences, EHC, WFH, and others, collaborating in research, especially related with basket trials. That could be very important in terms of getting some new treatment for these people with extremely rare bleeding disorders. And we've been attending conference because we need to know more, and especially we need to engage with other bleeding disorders societies and groups. Slide, please. So we present this poster at WFH with an article about our survey, just to mention. So you can access this in our website. Slide, please. So how do you want our future be? A world when we can live normal and fulfill lives, where we have treatment, where we have care, where we have a truly comprehensive care for all of us, not only for hemophilia and von Willebrand. We need to have a comprehensive care that can support and advocate for and have a better quality of life for people with extreme bleeding disorders. We need to create a powerful network. Olivia already said that we are working with a lot of stakeholders. Because it's the only way, we believe that we can gain common knowledge, and all different organizations can work for the same benefit, the people with extreme rare bleeding disorders. We need to raise awareness about this kind of disorders, implement this idea in the healthcare systems. They need to be used that there are some disorders and some conditions that need to be addressed. that the inclusive society needs to take care of these situations and make possible to these people that they have a decent life, a life with quality of life, and to have the right to have a family and to have a right, especially and above all, to live a normal life. And better knowledge and understanding of rare bleeding disorders, and we need to fight for treatment and care, but above all, we need to fight for the better investment in better treatments, and for some in some cases to have just simply have treatments. Slide, please. So the conclusion. ERIN must work hard to build a network of support, and these people need to see that we are working for them. And I think it's the only way they can understand that they have here some people that can understand their problems, some people that they can connect, some people that they can just have a conversation and don't feel isolated anymore. That happened with people with inhibitors, and I think it's perfectly doable for people with extreme rare bleeding disorders. Rarity should not be a criterion to prioritize care as each individual counts. Should be the opposite. Rare people generally are underserved, and they need to have the full attention for our health organization groups in each country. All animals should have a plan to involve all rare bleeding disorders in their strategy, and I think without the work of animals and the work they need to do regarding this inclusivity, our work and our plan will not succeed. So it's quite important that they realize that they are the pillars of our community. The animals, EHC works toward animals. We provide guidelines, we provide tools, we provide our full support, we provide knowledge, but the animals needs to provide all of these transferred to their patients, because EHC don't work directly to patients. We work to our member organizations, and they need to work for their patients. So it's a thing they need to do. It's a thing that they need to interiorize in their minds and in their working plan. So it's now the momentum to continue working on rare bleeding disorders, to get attention, better understand, and especially to become more inclusive and be more empathetic with our community. So this has to be done in collaboration with all stakeholders. If not, we are not going to succeed for sure. Slide, please. So what to look out for in terms of EHC for the next month? We are going to have our annual EHC conference in Sofia from 4 to 6 October 2024. And for 28 November to 1st December 2024, we are going to have in Zagreb, in Croatia, our second ERIN summit, not only for patients, but for families, for kids. So we are going to have a double plan for that. And for sure, briefly, we will know what our program will be. So we need you to help build the future. We need you to pass the message that it's very important to take a good care. We are only a complete organization if we look to all the diversity of our extreme and rare bleeding disorders. So you can follow the EHC work in the following links that you have in front of you. The next slide, please. And thank you a lot. It was a pleasure to be with you.
Thank you very much, Miguel and Olivia, for this really interesting presentation on these EHC initiatives, and especially the ERIN program and how they seek to address the needs for greater inclusion in the inherited bleeding disorders community. Just before we take questions from our audience, I'd like to draw everyone's attention to the chat. If you look at the bottom of your Zoom screen, you should see an icon for the chat. And if you click on that, you should see a message from me with a link to the EHC website, where you can learn all about the EHC and its programs, including the ERIN initiative. So maybe just take a moment, copy that link, save it somewhere so that you can go back to it after the end of this webinar. So we'll go ahead now with our live Q&A. And I will start with one that kind of just jumps off one of the last things you mentioned, Miguel, and I'll let you know that this comes actually from Dawn Rodoliti, who sends her regards. She was asking, what role might there be for international collaborations with organizations like NBDF? You talked about the importance of collaboration with all stakeholders when it comes to extremely rare disorders. what's the opportunity for international collaboration with organizations like NBDF in the work that you're doing here?
First of all, we already had collaborated with NBDF in the past. We attended the Inhibitors Conference or Summit in NBDF for several years. One of our members from our ERIN committee was there. It was a great opportunity to learn how our Americans patients are working and what they are doing in terms of organization to assess and to address the needs of people with inhibitors. And for sure, we applied that in our annual summit for people with inhibitors in the past, and after that for the people with extremely rare bleeding disorders that we are doing now. So I see it as fundamental to work with other patient organizations. It's paramount that we exchange experiences, because this is we are starting to worrying seriously about extremely rare bleeding disorders, and we can afford to let go the experience that we are collectively acquiring. So sharing is important. So of course, for us, it's a pleasure at EHC. We are always welcome NBDF and other patient organizations to come to us to share their experience. We even can manage to find a space for them in our programs. It will be a pleasure, really. And we, for sure, if we are invited, we are going to attend other meetings, other conferences, because sharing is essential for us right now regarding extremely rare bleeding disorders.
Great. Olivia, maybe I can put a question to you that touches on something that you and I share an interest in. When you're talking about providing resources to so many people in so many different countries with so many different languages, and this is fairly complex information that you're wanting to provide really accurate information. What are the challenges of doing that in different languages?
Well, I'll tackle that one, maybe Miguel.
Okay, fine.
This is the biggest challenge, I think, for the EHC. As Miguel said previously, we interact with NMOs at leadership level and people who speak English, and then they have to disseminate at national level. But yet we feel that there's a gap there, and we are considering and probably implementing as of 2024 and mostly 2025. We would like to implement more translations and localizations, but as you know, it's scientific wording. We need to make sure that what is translated is well translated. Otherwise, it's counterproductive. So we're gonna work in collaboration with NMOs to maybe help them, support them translating and especially proofreading afterwards. We also want to develop infographics that are easier to understand than scientific texts. And we are considering developing resources in a more lay language than what we have. And of course, the acronyms, everything is kind of easy for us to understand. And each time when I have slides to proofread or to develop, I make sure that the acronyms are explained at least at one point, because we need to make sure that everybody understands what we're talking about.
Yeah, that is a real challenge, but it's the sort of text, lessening the text and increasing the sort of visuals. That's a great key, and yeah, the lay language is really important. And interesting, I was really interested to see that you're doing some podcasts, which I think sounds like a great way to have some of that connectivity. You know, when there's 1 in a million, you're not going to run into somebody else with the same disorder as you, and yet it's so important to hear and see someone else who has the same disorder as you there as well. I mean, are there issues with doing a podcast? I guess you have to do it in English, but this is not the first language of a lot of the people you're reaching out to.
True. But we saw it as a tool. For example, when we start organizing a podcast called Bleeding Disorder of the Month, we know perfectly well that we can apply subtitles for that podcast and send it to our NMOs. So they can have a tool that they can use it at a national level, for example, at the annual conference, and lots of our NMOs are doing that, and they can start a conversation about extremely rare bleeding disorders, because it's really advocating in two ways. One is towards our NMOs, but the other one is our NMOs understand that they need to serve a broader community, and the only way to do that it's call the attentions to all community that they already have, that there are other people there that are suffering probably the same things that they suffered decades ago. So it's a question of being empathetic. It's a question of inclusivity, but it's a question of calling to the best part of us as community to address the needs of others. And I think in terms of podcast, they are simple tools. They are quite direct. People can attach to that and can mirror themselves when you have extreme well-being disorders. When someone is telling their experiences, their testimony about is how to live. For example, people with Glanzmann bleed a lot in a way that people with hemophilia don't. So they need to understand that, and that's one of the main things that our community should be aware and should be working as a community.
That's really interesting that you bring up Glanzmann's, because we had a webinar on Glanzmann's not too long ago with somebody from, I think it was Saudi Arabia, where the prevalence is actually higher than that of VWD. And so they have a lot of experience with it. And it's really there again, I think there's that opportunity to collaborate worldwide, because somewhere someone else is dealing with this, and that expertise is out there and that familiarity is out there. Another question that we've had from somebody, they've asked how to learn more about ERIN. They're interested in ERIN and they'd like to learn more about it.
Well, they can, on the website, on our dhc.eu website, they can go there and they can find also all kinds of resources, but also the contacts of the ERIN committee, so they can reach out. Register, if they're in Europe, they can register for the ERIN Summit. That would be lovely to meet in person. Again, it's a family event, so even with children, it's the only event with children because it's a high responsibility, and this is not usually the remit of the EHC, but seeing the difference it made for the inhibitor community, I really think this is the way to move forward. So yeah, the website and joining our events.
Great. And you mentioned, Miguel, the importance of the NMOs reaching out and finding those people with other bleeding disorders and welcoming them in. How are they doing that? How are you recommending to them? How are you helping them? Or what innovative ways are they finding to find these people with these ultra rare bleeding disorders and bring them into their working groups?
I think the key of success for that bringing people to the community is have a good relations with healthcare providers, especially with the centers, because we know that people with extreme rare bleeding disorders exist. For example, a country with 10 million can have two or three people, or let's say 5 with Glanzmann. So if you can ask the centers of have a good protocol of a good relationship with the center, it's more easy to get them because they know who they are. Of course, they need to, in terms of confidentiality, there are some rules and some barriers. But for example, if an NMO organizes a conference and invites a doctor from a center to talk about an extreme rare bleeding disorders, it will be easy for the doctor to talk with the patient and say, look, I'm going to talk about this. What do you like to come? And so the connection is made. So it's a way of doing things. It's some suggestions that we have. We don't have, of course, some wonderful ways of advising things, but I think some basic things like this can solve even probably better than national calls of some kinds of strategies that involve advertisements or things like that. Sometimes it's the direct way with health professionals, doctors, it's the best way.
May I add something at European level, which is very important, and I'm sure our representative at the European Reference Network wouldn't be happy if I didn't mention the ERN, European Reference Networks, called EuroBloodNet for the European level. So unfortunately, it's European Union, so it doesn't count for those non-EU members, but still it's something good because when you come from a country where you suspect something is happening, but you don't have a proper diagnosis, you can reach out to reference center, and the ERNs are made to make patient organizations and physicians collaborate. So you have good reference centers to put the diagnosis in and to treat people if needed. So sometimes it really works also like that, but it's very difficult to find again those people, and if they're women, it's even more difficult because they tend to undermine what they're suffering from, and they don't know that it's something that they should be checked and treated for.
Right. Yeah. I think we see that across the board. Something that I was curious about in the survey, you mentioned that you had responses from 8 NMOs, and I think Olivia mentioned that you have over 40 NMOs. Does it tell you anything in terms of who you heard from? Does that tell you anything about who you might be encountering barriers to reaching, or who might be encountering barriers in accessing what you have to offer, and whether there's anything that you can learn just from that?
It tells us two things. One is that we need to do another survey next year, so to assess our work. So because the survey, if I'm not mistaken, was made in 22, 23. So it just shows us the workload that we have in front of us to better address these issues to our animals, because we know that will be hard. It is going to be hard anyway, but this shows the little number of answers to our survey. It's demonstrative that they are not quite into extremely rare bleeding disorders. So it's not we don't see it as a negative. We see it as a way of improving the level of responses, and that we need to work better through that.
I have a question that's come from one of our audience members, which is maybe you expected this one, coming from the National Bleeding Disorders Foundation, whether any thought has been given to changing the name of the European Haemophilia Consortium to include other bleeding disorders.
Yes, it's like the question that we ask ourselves each year. I don't know, from the last 6 years, perhaps each year we have just a meeting for that. And we've been thinking about it, frankly. I don't say it's important. For me, it's more important to have success in terms of addressing the real needs of these people. And if we can implement some of these measures in some of our animals, we will be super happy. But of course, we are thinking about it, and probably in the next years, eventually that will come out, because I think it's a question of inclusivity. It's a question of putting all bleeding disorders in the right place, and of course, but animals needs to do the same. And I know that some other patient organizations had a difficulty in facing that, and sometimes it's just a question of brand, and sometimes it's just a question of people get used to it, and sometimes it's just a question of mental blockade from people in changing things. So I don't know. There are several reasons. We constantly are thinking about that to best represent our community in terms of nomenclature. But as I said previously, if we can change it, if we don't know nothing about it, it's worthless.
May I add also that the NBDF has proven that it can happen, that it can be done. Considering the difficulty of the structure of the states, it can be done. So kudos for them, and also that we have a super engaged community. We just had our extraordinary General Assembly where we changed our statutes, and we had only 8 NMOs, unfortunately, on the survey, but at the GA, we had 39 NMOs represented out of 48. So that means that there's hope that we can tackle this issue and this topic in the next years and have a discussion. And then it will be up to those NMOs to decide. But I think it's worth trying, but not right now. I just arrived, so please spare me.
Yeah, I think NBDF would probably agree that there's definitely work involved in that. It's not something that happens overnight. Something I was curious about, and just thinking again about the parallel between the US and Europe, or the differences. I know that advocacy for bleeding disorders takes place at the state level and at the national level in the US. There must be some challenges involved in advocating at the European level and then at each of the country levels, because you must have quite a diversity of contexts there. So when you're looking at advocating, and if you're trying to do advocacy around ultra rare bleeding disorders, you must have very different contexts in different countries. Do you want to address that a little bit? What is that like, trying to work in that context?
Yeah, like Olivier says, it's from Reykjavik to Tajikistan. So we have uniformity. So that's why we organize a leadership conference this past weekend. is that we need that they learn by sharing experiences. If you can see that your neighbor have a better care that you can advocate through that. If you see that some people are trying to have some strategic approaches and organize your NMO in a different way, you can learn from them and apply it to your country. But of course, it's very difficult right now. But that's why EHC decided in our strategic plan for the next years to go more to our animals. And we recognize that that was a fault that we have in the past, not to go that much to our countries, because the only way that you have to assess the discrepancies is to be there. And since it's a huge distance from here to Tajikistan, probably we need to go there. Probably we need to go everywhere to inside to see and to understand the people that live there, the problems of the people that live there in terms of care-problem disorders, and what they need from us. And sometimes they are very shy in saying that to us. Sometimes they don't just want to bother us with their problems. You know, it's difficult. So if you go there, it's easy, and that's we are aiming for the next years for sure.
Right. And you
Yes,
can really
Olivia?
they need to feel the sense of community, and that's the first step to belong to the community and be able to take control of the path and the journey. But back to the advocacy issue, the structure, when you have, we have two structures. We have the European Union, and then we have every other member state that doesn't belong to the European Union. So for the European Union, you can advocate at European level for certain things. And for instance, the market authorization process is European. And then for access and treatment, you go to the national level. So it's another journey for the pharma company, but also for the patient organizations. So it's not exactly the same process then to get what you want from European level. But we are also working with in multi-stakeholder groups in order maybe to have joint health technology assessments for several countries at the same time to speed up things, so we can maybe find a way to get market access for countries that it's too long for them to have that. So it's a balance between helping the NMOs on one side, advocating at national level, and at the same time trying to shape the policy or influence. And now we just had European elections, so we need to wait for the new MEPs to be in place. So 2024 is kind of a transition year for us at European level.
Right, it's quite complex. So we'll maybe close with a question, and it's sort of a big question, but we've only got a minute or so left. So, and it's a forward-looking question, I think, as well, that's come from one of our audience members asking, how has gene therapy impacted your work and the patient experience in Europe?
Well, it's not a question just for 1 minute, but no, don't worry. Gene therapy, we are very excited about gene therapy. But in Europe, right now, we have a lot of people that are underserved for more basic things like access to prophylaxis, for example, like access to multidisciplinary care. So for our remit as organization, we are always looking upon the future and looking upon innovation. And of course, some countries in our organization are at a different speed than the others. So gene therapy is a huge investment. It's even a huge mental investment for us as patients right now. So, but the important thing that we want about gene therapy is safety. If we are sure that it's totally safety for us and fully safety, we are going to embark on that with our full hearts. If we have some doubts, no. So it's a question of us being always attentive, being always demanding over gene therapy, and knowing for sure that for some countries it's a far away from now. So, but for others, it's just around the corner. But be sure that safety is the most important thing that we think when you think about gene therapy.
Great. Thank you very much for that. That wraps up the time we have for questions. I know we could keep this discussion going quite a bit longer, but a huge thanks to Olivia Romero-Lux and Miguel Cratu from the European Haemophilia Consortium for sharing your time and your passion for your work with and for the EHC community with us this afternoon. I'd also like to thank everybody in our audience for joining us. This webinar will be available on the NBDF website shortly after the webinar. If you go to the NBDF website, bleeding.org, under the events tab, select past events, you can find recordings of all the previous webinars. You can also see the upcoming webinars. So join us again in 2 weeks on June 26th, when we'll hear from the NBDF Medical Programs and Information Team about bleeding disorder resources, referrals, and educational tools. Thank you so much for joining us this afternoon. Have an excellent week.
Thank you.
Thanks a lot.